Hello everyone, welcome to our teacher conference here at KidsAbility. We are very honored and happy to have you here with us today. My name is Marley Hubert. I'm an occupational therapist at KidsAbility and I'll present to you on sensory integration. So on our agenda today, we'll talk about our sensations and the senses. We'll discuss what sensory integration is and its key components. I'll talk a bit about sensory processing disorder and what we as OTs do with children that have sensory difficulties. I'll also be referring to the sensory profile, and then we'll discuss some classroom tips. So it is important to note that this presentation is not intended to offer any medical advice. And should you have any further questions, or if you go back to school and you note some of the difficulties that we discussed today in your kiddies, please refer them to a qualified therapist or a healthcare practitioner that will be able to assist them. Yes, so let's get started. So sensory integration is a very wide and complex area. It consists out of a lot of different systems, and when you specialize in sensory integration, it can take therapists years to complete their studies because it's so complex. So I'm going to try my best to make it as simple as possible today. So when you leave here, you can leave with a clear understanding of what sensory integration is. So when we go to school from a very young age, we get taught that we have 5 senses: our hearing, our vision, our smell, our touch, and our taste. And those all refer to our exteroception, which is outside of our body. But in reality, we have more sensations. So we also have our interoception, which is located inside of our body. So whenever you are hungry or thirsty, or you need to go to the bathroom, or you have a stomach ache, your interoception is activated, and that sends signals to our brain. Then we also get our proprioception, which includes our vestibular system and our proprioception system, or proprioception. And this is actually very important systems that we as occupational therapy therapists looks at when we treat children with sensory difficulties. So let's look at the senses that we focus on during sensory integration. So first up, we have our tactile system, which is our touch. It's also we also feel heat or temperature through our skin, our tactile system, as well as a pain. Next up, we have our vestibular system, which is located in our inner ear. And our vestibular system is activated whenever we move our head. So that gives our body information of the position that our head is in relationship to gravity. Then we also have our proprioception or proprioceptive system, which include our movement and our joints positioning, and that is located in our joints and in our muscle spindles. So whenever we move our limbs or move a joint, our proprioceptive system is activated. Then we have our auditory system, our visual system, olfactory, that's our smell system, as well as our gustatory system, which includes our taste. So what is sensory integration actually? So I'm going to refer to some definitions that Jean Ayres gave. She did her research on sensory integration, and she defined it as the organization of sensory input for use. Sensory integration is also the neurological process that organizes sensations from one's own body and from the environment and makes it possible to use the body effectively within the environment. Another definition that she gave was sensory integration is the spatial and temporal aspects of inputs from different sensory modalities are interpreted, associated, and unified. Sensory integration is information processing. The brain must select, enhance, inhibit, compare, and associate the sensory information in a flexible, constantly changing pattern. In other words, integrate it. So what does this actually mean? We receive information about our environment through our senses. So all those senses that we talk about, we receive information about our environment through them. Then those information is sent from our sensory receptors to our brains. In our brains, it gets organized and our brains integrate it with information with previous experiences, and then it sends signal back to the body, informing it on how to react to the stimuli. So for example, when you make toast and suddenly you sense that your toast is burning, you get the smell of burning toast. So your olfactory system is activated. It sends information to our brain saying, I smell burning toast. Our brain integrates it and also connects it to previous experiences. So in the past, you've made burnt toast before, you know what the smell of it is. So now you can adapt your behavior and behave appropriately. So switch the toaster off. Or another example is if you sit in class and you hear the sound of the school bell ringing, your auditory system is activated. It tells our brain, I am hearing the school bell ringing, and now you can adapt your behavior and you know, I have to pack up all my bags. I have to stand at the door. It's time for my next subject. All right. So as I said, sensory integration is very complex and difficulties in all the stages. There can be a difficulty in any of the stages which can lead to sensory integration difficulty overall. So I think it's important just to discuss some of the key components. So firstly is sensory registration. So that is the detection of sensory stimuli. So when we look back at our school bell example, you're able to hear the school bell ringing. So that is the sensory registration. Next, we have our arousal, which is the level of alertness. Then we have sensory reactivity and modulation, which refers to the behavioral response to sensation. So the school bell rang, I heard it, I registered it. Now I know that I should pack my bags up and stand at the door to go to the next subject. That would be our reactivity or our modulation. Next, we have sensory discrimination, which is distinguishing and interpreting sensory qualities. It can be spatial or temporal features. Sensory process or perception refers to the ability to attach meaning to those qualities. Then another key component is our motor skills and praxis, like we mentioned before. Our vestibular system and our proprioceptive system tells our body how to move and where our body is in space. So those are very important in terms of our motor skills. And lastly, we have organization of behavior. So what is sensory processing disorder? When we talk about sensory processing disorder, we have three categories. which include sensory modulation disorder, and the subtypes is over responsivity, under responsivity, or sensory seeking. And they give us an example where a child has difficulty responding to sensory input with behavior that is graded relative to the degree, nature, or intensity of sensory information. Emotional and attentional responses to sensory inputs do not match typical adaptive responses. Next, we get our sensory discrimination disorder, and the subtypes includes visual, auditory, tactile, vestibular, proprioception, and taste and smell. So when a child has difficulty interpreting qualities of sensory stimuli and similarities and differences amongst stimuli. Emphasis is on discrimination of tactile, proprioceptive, and vestibular systems, and it relates to the development of body scheme. So that's the definition of sensory discrimination disorder. Then we have sensory-based motor disorder, which the subtypes includes postural disorder and dyspraxia. And for example, the child has poor postural stability with poor balance and hypertonic muscle tone. A child with dyspraxia has impaired motor planning and has impaired ability to conceive of plan, sequence, and execute novel actions. So those are our main categories of sensory processing disorder. Yes. So when we assess a kid with sensory difficulties, we categorize them broadly in 4 different sections. So we all have a neurological threshold to sensory input. If you have a high neurological threshold, it means that you need a lot of sensory input before your brain registers it or before you can make sense of the sensory input that you're getting in. So on our high threshold, we get our sub-A or subtype A, which is the register. And those types of kids miss a sensory input and has a passive response to it. So, for example, the child doesn't show any response to when his name is called, or the school bells rings, but this child will only sit in their desk, and it will almost appear that they didn't notice the school bell ringing. Then we also have seekers, which misses sensory inputs but has an active response to it. So they seek out more input. So for example, the child enjoys and seeks out loud music with other intense sensory experiences, for example, rocking. When you have a low neurological threshold, it means that you can quickly get overstimulated by sensory input. So we have our sensor, which is letter C. Our sensor notices sensory input and has a passive response. So for example, the child seems distracted when loud music or the TV is on. And we also have the avoider, where they notice sensory input and have an active response to it. So a child has temper tantrum and is visibly avoidant when loud music is on. Or when the school bells ring, they'll cover their ears to protect their ears from the sensory stimulation, and also so that they can get less sensory or less input in. All right, so this little girl says, I'm overly sensitive to loud noises. I hate having my hair brushed or washed. I'm a picky eater. I seem to be unaware of pain and normal touch. I often feel others too soft or too hard. I have poor fine motor skills such as handwriting and cutting. I have trouble focusing and concentrating. I hate being tickled or cuddled. I chew on everything, and I have poor gross motor skills such as running and riding a bike. So this little girl definitely has some sensory difficulties, and this is the type of picture that we see when kids come into our clinic with a sensory referral or referral due to sensory difficulties. So it's important to note that sensory integration contributes to our level of alertness and our attention. So sometimes when the children have sensory difficulties, they find it more difficulty to attend to you during a lesson or concentrate in the classroom, especially when there is a lot of stimulation around, which often occurs in a classroom setting, right? A classroom is often quite busy with a lot of pictures and bright colors. There's a lot of movement around them. There's a lot of noise, other children talking. So it can be quite overstimulating, and it can affect their level of attention. It can also affect our cognitive and our motor skills, like we discussed earlier about the motor skills, but also our cognitive skills. It can affect our emotional regulation, our social interaction, and our behavior. It is extremely important to know that our sensory system is very closely linked to our emotions. So a lot of times we see temper tantrums or tantrums whenever a child is seeking sensory input or avoiding sensory input or feels overstimulated. That often leads to a temper tantrum, as well as our behavior. A lot of times the sensory kiddies can appear to be the naughty children in the classroom, constantly fidgeting, constantly up and down from their seat, running around, maybe pushing other children, maybe biting. And that's not because they're naughty or they're not disciplined. It can be that they just really struggle to integrate their senses, and that affects their behavior, or affects their behavior essentially. So what do we as OTs do? So the goal of intervention is to improve the child's ability to process and integrate sensory information as a basis for enhanced independence and participation in daily activities. Play, including social participation, as well as school tasks. So we help children to organize their responses to sensory input. We increase or decrease arousal levels. Our role is to educate parents on their child's behavior and strategies to use in the home environment, and also to educate teachers on how to support the child in the school environment. So when a teacher refers a child or a doctor refers a child for occupational therapy due to sensory difficulties, A lot of the times we send a sensory profile out to the teacher. I have a feeling that most schools on the island will give the teacher a sensory profile if there's any difficulties. So I think it's important just to go through the sensory profile so that when you receive this questionnaire, you'll be able to answer it correctly and fill it out. And also it just gives you some insight of different difficulties that we see in terms of how children process their sensory information or integrate it as well. All right, so the sensory profile consists out of different subcategories for all the senses, and it's a rating questionnaire. So you'll rate either you always see the behavior, where it's 90% or more of the time. You frequently see the behavior, which refers to 70% of the time. Half of the time is you see it some days not. So 50% of the time you observe the behavior in the classroom. Occasionally is when you observe it, maybe 25%. Almost never is you don't really observe any problems in that area. And does not apply is if that behavior does not apply to that specific student. So a lot of the times I get sensory questionnaires back where the teacher just writes does not apply, does not apply, does not apply. And that really doesn't give the therapist any insight about the child in the classroom. So I would really strongly advise you to think about it and maybe rather write in the comments explain to the therapist what you observe or what don't you observe in the classroom, rather than just clicking or just ticking the does not apply box. Does not apply would be, for an example, if a child is in a wheelchair, a question regarding running around will not apply to that child, right? All right, so the first section is auditory processing, and some of those questions include when the child tells all the other children in the class to be quiet, constantly shh, shh. Maybe they get then overstimulated by auditory input, or children that seems to tune you out in class or seems to ignore you in class, children that struggle to complete tasks in a noisy setting. Those are some of the questions that they ask. Next, we get our visual processing. And then that can be children that misses written or demonstrated direction more than same age children. Leave items blank on a busy worksheet despite of knowing the answer. Maybe look away from tasks to notice all the actions in the room. Those are the type of questions under visual processing. Then we have tactile or touch processing. And they say, my student gets too close to others when talking face to face, or doesn't seem to notice when face and hands remain dirty, or touches people or objects to the point of annoying others. Those are some of the questions under touch processing. After that, you'll find movement processing. Under movement, It includes some of the questions where the student is fidgety or disruptive when standing in line or close to other people. They may slouch or slump in their chair, might bump into things, failing to notice objects or people are in their way, and seems to find endless reasons to approach the teacher. I think you all have had one of those children in your class at some or other time, and it can be that they just can't sit still for an extended period, and therefore they feel the need to move around constantly, trying to stand up to get water, go to the bathroom, use any excuse to get out of their chair. It can be that there can be maybe some vestibular processing difficulties. Next, we have the behavioral responses associated with sensory processing. And some of the questions or items include: my child does things in a harder way than is needed, or appears tired. My child or my student could be described as overreactive or dramatic compared to the same age students, lacks a sense of humor. My student could be described as inflexible compared to the same age students, or is distressed by change of plans and routines or expectations, can be stubborn or uncooperative. So those include some of the problems that we usually see with children that has sensory difficulties. So it is crucial to refer a child for an OT assessment if difficulties with sensory processing are suspected, because every child is different and therefore their sensory needs and treatment program will be unique to them. The teacher should work closely with the therapist to ensure that the child receives the appropriate support within the classroom to establish an optimal level of arousal. If you note that one of your students have received OT and the therapist suggested that they use a move and sit pillow in classroom or one of those wobble cushions, it's not necessarily that one of your other children that's also a busybody will need that cushion, or that cushion will give them the support that they need, right? So whenever it's not a recipe, it's not straightforward, it's extremely important to work closely with the student's therapist so that you can make their classroom environment suitable for them and comfortable for them, so that we can see better concentration, better attention in class, better emotional regulation, improved behavior as well. All right, so a sensory-friendly classroom. So today, I think it's important to let you know that movement breaks is extremely important. I feel that we expect children, even very small children, to sit still in classroom for a long time, and that also impacts their interaction as well as their attention in class. So frequent movement breaks are very important. Things like yoga poses, wall push-ups, jumping jack, toe taps, those are all some activities or exercises that you can include in your class. So for example, in the morning, before we do the morning ring, just let's do 5 minutes of a movement break, and then we are ready to start with our morning ring after that. But in reality, we have to give them at least one movement break every hour to get up, move their limbs, move their bodies, and just get that sensory feedback that they seek and they need. Another tip is a sensory corner. I would suggest having a quiet corner in your classroom that the children can go to and calm down and use to self-regulate. Don't use the corner as a punishment or it shouldn't be a punishment. You shouldn't let the children go sit in the corner whenever they did something wrong. It should also not be a reward, but rather when you see a child is in distress or struggles with their behavior or struggles to regulate, you can give them a chance to sit in the corner and just calm down and regulate themselves. So an idea would be to teach your children some breathing exercises. You can do 4x4 breathing. Let them breathe in for 4 seconds, hold it for 4 seconds, and breathe out for 4 seconds. And you can maybe have a little visual tool in your sensory corner to help them with what strategies they can use, or just as a reminder that they can do some breathing exercises to help them to calm down. I would also suggest some soft pillows, a soft rug, or weighted toys in your sensory corner. And I wrote here fidgets as well, which I think is very important. But I would suggest that for your classroom, you develop your own sensory kit with different sensory toys inside, and that you keep your sensory kit at your desk in the classroom, and whenever a child needs to go to the sensory corner to calm down, they can come to you, pick one sensory tool that they would like to use in the sensory corner, and then take that tool to the little corner to help them relax. We all have different sensory preferences, and our body knows what it needs. So if you give a child a wide variety of different sensory tools, I believe that they will likely pick the ones that their body needs at that time. But if you just place the sensory bin in your sensory corner, I can promise you things will get lost, things will break. It's best to keep it with you. So things that you can put in your sensory bin. There's a sensory bin on the picture that just includes some, I think it's water beads, some sand, so you can have a little container with sand in, or with water beads in, or with rice in, or what else? Beads, beans, anything that has different texture and that we can feel and touch and explore and get comfortable. So in a sensory bin, I would usually hide different objects and get the child to find the different objects. You can even have a little treasure map and they can pretend to find treasure. Another tool you can use is fidgets or sensory balls. There's a few places on the island where you can buy lovely sensory balls with different textures. You get jelly balls and you get hard balls and balls with poppets in and soft balls. Another tool is weighted toys. It's just important to maybe consult with a therapist to make sure that your weighted toy is the correct weight and it's not too heavy. So a weighted toy provides us with deep pressure. So our tactile system is activated, we get deep pressure of the weight of the toy, and that deep pressure is extremely calming to the nervous system. It's the same input that you would get from a tight hug. So that's also something that you can use when you see a child is overwhelmed. Just ask them if they would like a tight hug, or they can hug themselves as well. And that deep pressure calms our nervous system. That's the same reason why we swaddle babies as well, as when they're upset and when they're young, when they're babies, we swaddle them in a little blanket and make it very tight to calm their nervous system so that they can go to bed. Then there's another visual one, a visual timer. I used to see a little boy who had a lot of sensory difficulties when I used to work at a school-based practice in South Africa, and I had those timers in my therapy room, and he noticed that I had them, and then whenever he got overstimulated during the day, sometimes I'll just randomly see him in my office. He'll just sneak in, grab one of them and just turn them around, up and down, and watch the bubbles as they go up and down. And I mean, he would sit there for minutes, sometimes just quickly, sometimes a long period, but that would calm him so much. And when he feels regulated or felt regulated, he would go back to class and carry on the rest of his day. Another thing you can use is Play-Doh or slime. I've also included headphones in there. You can use headphones for some of those children that's auditory sensitive, might want to use headphones to protect their ears and to restrict some of the inputs. So those are just some of the tips that you can use in your sensory bin. But honestly, you get so many different sensory toys and tactile toys. You get fidgets, you get poppets. You can, at any shop, you'll be able to buy something sensory related, which could really help the children, what the children can benefit by. All right, some other tips, some self-regulation tips is place your finger under your nose. So you place your finger and press it down. So this is some of the tips that you can maybe include or use with your children while they're seated at their desk, while they're in their chair. So the next one, like I said, giving ourselves a tight hug. Wall push-ups. When we do wall push-ups, immediately our head moves, so our vestibular system is activated, and we do heavy work. We use our muscles, so our proprioceptive system is also activated. Then push-ups. Push your hands on your lap and press down. Finger to thumb movements. 4x4 breathing, which I already explained. Push your fingertips together. That's also that deep pressure. And then chair push-ups. So this, I thought I'll include this just to give you some tips of how to calm them down in the classroom. On some kids it works, on some kids it doesn't work. Like I said earlier, we are all different. We all have our very own unique sensory profile. We all like different things. even me, I have my very own sensory profile as well. I'm very sensitive to sounds. So, for example, when I used to study, I was not able to concentrate without earplugs in my ears. Otherwise, I would just get distracted by everything around me. I'm also very sensitive to tactile. My tactile system is very sensitive, so I don't really like the feeling of dust or sand underneath my feet when I'm on ground. I don't particularly like walking barefoot feet. But just to give you an idea that we all have different profiles and we all are very unique, and therefore we're not able to just give you a recipe and say, do this with your child, or if you have a tactile child in your class, try this and this will work perfectly for them. It's a trial and error situation, and also it's extremely important to work very closely with the therapist, so that you can provide the child and support the child. You can provide them with an optimal environment for learning and also support them in that environment, because at the end of the day, you guys see the children for a big portion of their day, and it's important that the teacher knows how to help the child that has those sensory difficulties in that environment. A lot of my times before, I had parents coming to me saying that my teacher reports everything's fine at school, but once my child gets home from school, there's a complete meltdown. Or they're just jumping everywhere on couches. I can't seem to calm them down. And then I have to explain to them, like I spoke about earlier as well, classroom environment is a very sensory rich environment, and it can easily overstimulate some of the children with difficulties, and that's why it's so important that that child has the appropriate support system, so that they can function optimally. All right, that is it for today's presentation. Thank you so much for taking the time to listen to me. If you have any questions, please feel free to contact the clinic or email the clinic, and I will be happy to try my best and answer all the questions. Enjoy your day, the rest of your day, and thank you so much for listening.